Welcome, everyone. We're glad to have you today and be with you. It is Wednesday, April 29th, and I'm Jen Rumbalski, the Director of the Crosse County Health Department. And we've got some information to share with you today. In addition to one of our staff members who's a public health nurse will share information about contact tracing and what it is and what it looks like. So it'll be great to have her on as well. So in the county today, we identify one new case. And this is an individual who is female in her early 30s. And she has had no fever, but has other symptoms that are in alignment with we're going to talk about some of the CDC symptoms, and I'll show you a graph of the symptoms that our cases through the first 26 cases have had. So I'll talk about that in a moment. We have a total then of 29 cases with the added case from today. 26 of those have recovered. We have a total of 1,959 that have had negative results in our county, and that is about a 1.5% positive. So of all those that get tested, about 1.5% are positive or have a lab confirmed case. We continue to have no hospitalizations and no deaths. In the state of Wisconsin, our total positive cases has gone up from yesterday by 231. And our total of positive in the state is 6,520. Negative test results are 66,630, and that is up 3,095 from yesterday. That is an 8.9% positive of all of the testing that has been completed for Wisconsin residents. To date, our total hospitalizations in the state are 1,489. That is up 33 from yesterday and is at about 23% of those that have lab confirmed COVID-19 need hospitalization. And we have a total of 308 Wisconsinites who have passed away from COVID-19. That is up 8 from yesterday. So we want to share a little bit of information in regards to what symptoms we have been seeing with our cases. First of all, just share that the CDC added 6 new symptoms as recognized to be symptoms of COVID-19. And those are chills, repeated shaking with chills, muscle pain, headache, sore throat, and a loss of taste or smell that is new to them. So at this point, I'm going to show you a graph that will depict the symptoms that we've seen in our cases. So what you're seeing here on the screen is the prevalence of select symptoms during the course of illness for the clients that we have had in our county. And this is through April 12th. So this includes our first 26 cases in La Crosse County. So you can see here that the most prevalent symptoms are shown at the bottom. So cough at just about 85% of those that in our first 26 cases, at some point during the course of their illness, it may not have been at onset, had cough as a symptom. And as you see that the chart from the bottom continues to go down to the lesser frequent symptoms. So cough, fever, muscle aches being the top 3, but then also noticing loss of taste or smell at 26% of our 26 cases had that symptom. And so I think it's helpful to see the various symptoms that our clients who have had positive lab confirmed cases of COVID-19 have had. And we will share this on Facebook as well. One of the other updates I wanted to share was about the food drive. So we have Friday food drive, and we reported last week about the food drive numbers from the week before. Last Friday, we had our second food drive, and it was very successful again. So the numbers or statistics from that are 12,745 pounds of food were collected in a 2-hour time period. And additionally, there were $11,512 collected. So we have definitely met the match requirement for the anonymous donor in our community, but we continue to push forward, and just so impressed with this community and how much they have come out to support those that may struggle with food insecurity and not having enough food, particularly knowing that there are individuals who are not currently able to work, and those that might have struggled before. We add to that number now with the current economic challenges that are faced by the families and individuals in our community. So thank you from us and others who are working on this food drive to make this successful. It cannot be successful without all of you in the community participating at the level that you have been. What a wonderfully successful food drive those two first food drives have been. So we hope that keeps going. Just a reminder that we will next week be starting our briefings. We'll go from Monday, Wednesday, Friday this week to Tuesday, Friday next week. So we'll have a briefing again at this time on this Friday, and we'll be asking, or we'll have a guest on, Dr. Eberlein will be with us, who is the medical director for Tri-State Ambulance, as well as an emergency room physician at Gunderson. And so he'll be on to talk with us and all of you. And then we'll be on Tuesday and Friday next week, and we'll be having additional topics covered then. At this point, I would like to turn it over to one of our fabulous individuals in our health department who is leading the team to make sure that our contact tracing and disease investigation is as successful as it has been. She has a lot of experience, and I'm really glad that she'll be on to talk to you a little bit about what that process looks like. So Brianne Weigel is a public health nurse in our department, and Brianne will tell you more about what contact tracing looks like.
Thanks, Jen. Good afternoon. I'm Brianne, and I'm a public health nurse at the health department. I am just one of the many public health staff who make up the COVID-19 disease investigation team. Today, I'm going to provide a brief overview of the contact tracing process and why it is crucial in preventing the spread of the virus. Contact tracing has been identified in the Badger Bounce Back Plan as a key component in controlling the spread of COVID-19. Contact tracing is a public health strategy that has been used for decades to control the spread of infectious diseases by identifying and notifying people of possible exposure to disease. For COVID-19, we provide education and follow-up to individuals who have been exposed to the virus in an effort to contain viral spread within our community. So what can you expect if you're involved in a COVID-19 investigation? Our health department is notified of both positive and negative COVID-19 test results through the Wisconsin Electronic Disease Surveillance System, also known as WEDS, which is monitored 7 days a week by our public health staff. Anyone who tests positive for COVID-19 is interviewed by public health within 24 hours of receiving that notification. One of the main goals of this initial interview is to find out where they have been and identify anyone they may have had close contact with during their infectious period, which starts 48 hours prior to their symptoms developing. We gather details from the individual on the type and nature of their interactions so we can determine all the contacts who are at risk of infection. A close contact is defined as any individual who has been within 6 feet of a person infected with COVID-19 for more than a few minutes without using a face covering while that person is infectious. Health department staff confidentially notify people who are at risk for becoming infected. During our phone interviews, we provide guidance on self-quarantining for 14 days with the goal of limiting exposure to others if the close contact were to become sick with COVID-19. We use a 14-day quarantine because it can take up to 14 days for someone to begin showing symptoms from their exposure to COVID-19. Contacts can report their symptoms electronically through the WEDS system, or public health staff can check in with them routinely during the 14-day monitoring period via phone or email, just to touch base and see how they are feeling. We also talk with the contact about what kind of symptoms they're having, when to seek medical care and or testing, and how to isolate themselves from their household members. It's important for contacts to be notified and asked to self-quarantine and monitor themselves for symptoms, because we know that they're at increased risk of becoming infected with COVID-19 due to their exposure to someone with the virus. So contact tracing is a time-intensive process, but it's critical in preventing the spread of COVID-19. Most individuals diagnosed with COVID-19 will have some close contacts they identify. But by staying at home and following our safer at home order, it greatly decreases the number of people needing follow-up and monitoring. So we know that it's been challenging, but staying home reduces COVID-19 exposure to those we care about and the community in general, preventing our healthcare systems from becoming overburdened. So that's a little background on contact tracing and why we do it. Lastly, on behalf of the case investigation and contact tracing team at the health department, We'd just like to thank all the cases and contacts that we've worked with for your cooperation. Your time and willingness to follow our recommendations is helping to keep our community healthy. Thank you.
Thank you, Brainy. It is so important, I think, to remember that people who get lab confirmed with COVID-19, it's not like they've done something wrong. They've been exposed and have therefore become, infected with that. And they, thankfully, 26 out of our 29 cases have recovered. And I think listening to Brainy helps us all remember that these are humans. These are friends and neighbors and perhaps coworkers who have been in contact with us, and we've connected with them in a way that is important during a time that they are not feeling well, and it means that we can assure that we are not allowing the disease to spread to others. So I'm grateful for Brainy and her team and all that they've done. And also, as she said, for those that have given all of the information on the phone to the disease investigation and contact tracing team. It's an important communication and conversation that happens. So thank you, Brainy, for sharing those details with us. So that is all that we have today for updates. We'll take questions now from our media partners.
Chuck from News 8, do you want to go ahead?
Yes, I'm sorry. I can only see Colleen on my screen. Is that my mistake, or is that something you're doing?
Nope, that's okay.
And I can hear you, Chuck, if you want to ask your question.
Yep.
Yes, but I can only see the interpreter.
Yep, on Facebook it has both Colleen and Jen.
But I'm recording in an edit bay, not on Facebook.
Okay, I'm not sure. Do you have a question for Jen?
Not at this time.
Okay.
Hi, Jen. Marcus from News 19.
Hi, Marcus.
Hey, so we've seen just some few early studies of COVID-19 showing that men are more likely to contract it and then die from it. Why do you think men are more likely to get this virus?
So the question being, why are men more likely to get this virus? So what I can tell you is that here in La Crosse County, the number of individuals that are lab confirmed, it's a small number with just the first 26 that we've analyzed, but we have actually had a 50-50 split of males and females. And actually our last 3 cases have all been females. So we have more females than males currently in La Crosse County who have gotten COVID-19. I have not seen any evidence behind reasons for more males or the severity of males. I think it would be interesting to look at the other aspects of those cases to include, are they in other higher risk groups? Is the fact that their gender is male, is that truly why? Or is it because that they have had underlying health conditions, for example, or they are in age groups that are at higher risk of having severe disease when they get exposed and come down with COVID-19. So I don't have anything that I've seen that has indicated that males would be more likely to have severe disease.
Marcus from News 19 again. I don't know if Brainy would also be able to answer questions, or you, Jen, but when you're having this contact tracing and you're continuing and maintaining these relationships with people who've been tested positive, what's it like starting with them and then going through the whole process?
Yeah, so I can answer that. So what it's like is, these there are both nurses and there are health educators who are very skilled at doing this in our department. And this is a cold call, frankly, to start with, that they contact these individuals. They speak with them on the phone. They let them know who we are and why we're calling them and what information we need from them. It can sometimes require patience because individuals may or may not have been notified already by their healthcare provider that their lab test was positive. We typically like to try to let them do that, but we also have a time frame to make sure that we're getting contact from them in a timely fashion. So in general, though, that goes very well, I think. These are individuals that are really skilled at developing quick relationships and trust, developing trust. That's something that health educators and nurses are trained to do and are naturally really good at. And so initially, that's what the conversation is about. It's about quickly developing a relationship through trust and helping them understand who we are and why we're calling and what we need from them.
Jen, we had a question from Facebook about protesting in Madison. If there were individuals in La Crosse that did protesting, are we worried about that and that exposure and potentially bringing it to La Crosse County?
Yeah, so the question about protesters going to Madison, we did hear anecdotally that there might have been individuals from our county who went down and protested in Madison. I know that law enforcement and the mayor's office and others had talked about, just trying to assure that people, if they were going to exercise that right, that they did so safely. We have not yet seen any cases connected to that, but it is still fairly early. And, I think it seemed to me like the protesting that happened, at least from what I saw, that there was physical distancing. I'm sure that there were examples where that was not occurring, but we haven't seen any specific cases in our county from individuals who had participated in that and may have been exposed as a result of that activity.
Jen, we've seen a lot of hubbub on our Facebook page and all over. What's your response to the VP not wearing a mask at Mayo?
Yeah, so my response to that is, and I heard Vice President Pence say on the news that he gets tested routinely. We know that individuals can carry the virus and not have symptoms. We also know that tests can be false negative. I think for those reasons and the fact that everyone around him was wearing a mask and Mayo indicated that that was their policy, and he is a significant leader in our nation, that we should lead by example. And we recommend to all of our residents to wear masks. And the reason we do that is because if you were to be an asymptomatic carrier of this virus, and there are cases of that in counties around us, that you would then significantly prevent potential exposure to others. So being in a facility like he was in, I would say to any leader, and really I've said to all of our residents as well, that it is the responsible thing to do is to wear a face covering when you're out and about.
We're seeing events getting canceled already for August and September and even October. Why are they getting canceled so soon?
Yeah, so as far as events go, that is very difficult to gauge whether or not you should cancel an event. And we have not recommended routinely for events to be canceled that far out. In fact, we have been contacted recently about one that was going to occur in early June. And we said, if you can wait a couple of weeks, then we'll have more information about where we're at. But I think there's so much planning that goes into those events, and a lot of need to notify people well in advance. And I know that we've been talking about, and I want our residents in those in counties around us to know that we expect to see multiple peaks of this virus, that this is just the first peak. We don't know if additional peaks, when they will happen, how big they'll be, if they'll be smaller, larger, or both, compared to the one we are currently having in La Crosse County and in the state. So we don't expect that this is the only peak we will see. For that reason, we know that this will continue to be a risk, and we give that information to anyone who asks us for guidance about whether or not to cancel an event. And I think a lot of times we're seeing that they're making decisions with the best information they have and making them in a way that they think is the safest for those that would be at that event.
We do have one more from Facebook asking about contact tracing. And when the contact tracers are following up with individuals who are positive, is it recommended for them to answer the phone and to cooperate, or is there some enforcement that goes behind that? Can you tell us more about that process?
Yeah, so in terms of contact tracing, there are some times when we can't get a hold of someone and we don't know if they're just not answering the phone or if they're not home or they're sleeping. But in general, I can tell you that it's rare for us that we aren't able to reach someone. And really people are very willing to talk with us once we help them understand who we are and what we're asking about. There might be times when we need to leave a message, for example, and then they contact us back, sort of a screening process. That's fine if that's what individuals need to do, but do recognize that this is being done for a very particular reason to protect them, the person who's positive, as well as the potential contacts. We want them to know that they may have been exposed, and then we need to be able to assure that the community is safe as well. So those are all things we're looking at. And in general, people are very willing to speak with us. And I think, we're just grateful that individuals do that. We've never had significant challenges, not even just with COVID-19, but with other communicable disease reporting and follow-up that we do on a very regular basis in the health department. It's part of the foundation of what we do across multiple different diseases, and we just routinely have very good conversations with most individuals. So we recognize that it's different to have somebody you don't know at first calling you, but we really get good feedback from individuals. So yes, we do want you to answer the phone or at least call us back.
Do we have any other media questions for Jen today? It doesn't look like it.
Well, thanks everyone. And we appreciate you being on with us today, and we'll see you again on Friday.